All right. And good evening, everyone. And welcome to this episode of the Ask Dr. MJ. Why? Because your health is important. Facebook Live, Instagram Live, YouTube Live, and now TikTok Live. Medical presentations where you, the listener, are allowed to ask your healthcare questions. This is the only interactive forum that allows you to provide that service, and we are so glad that we are here to do it for you. So welcome, welcome, welcome. If you're a first timer, we are so glad that you have opted to join us. It's not too late to send texts and emails to your friends. Tell them to log on to AskDrMJ on the YouTube channel, and also subscribe while you're there. Go to the YouTube channel and subscribe, where we have hundreds of videos that explain a lot of my medical topics, as well as how to use the Lipo products, etc. So we're glad to have you here this evening. Now, for those who are listening to the Rickey Smiley Morning Show's broadcast this morning, the Wellness Wednesday, we spoke about the new science of anti-aging. And what does that mean? That means, increasing your lifespan, not only making you live longer, but allowing you to live a healthier life. So I'm going to give you my 5 top tips that should make a routine lifespan now could be as long as 120 to 150 years. Now, that's going to wreak havoc with the retirement centers and the Social Security and the Medicare, because people are going to be living longer, but they're also going to be doing more things. They're probably going to want to work longer because they're just going to feel good. And so this average lifespan that we have now, 70 plus, particularly for people of color, African Americans, you can look forward to a lifetime. And starting right now, if you are in your 50s, 60s, starting right now, you can increase and improve your lifespan by doing and sharing one of Dr. Collier's 5 longevity secrets, recommendations to live a long and healthy life. Number 1, exercise. Studies have shown that 30 minutes of exercise daily can help control your weight, boost your energy, enhance your cognitive function. So for those who are getting a little forgetful or worried about do they have early signs of dementia or Alzheimer's, exercise improves brain function, and it promotes a better quality of and healthier sleep. So if you are getting a good night's sleep, your body is resting and restoring and healing. So if you're not getting a good night's sleep, if you're not getting deep REM sleep where you are dreaming, you're not getting quality sleep, even though you may be in the bed. And although the recommendation is to get 8 hours, ideally, most people, if you can get six minimal, 7 optimally, then you are doing quite well. Nobody I know gets 8 hours of sleep. You just can't do it, and most people don't. Most people are staying up to around 11 o'clock, sometimes midnight, and the universal wake-up time for most people is 6:30 a.m. So you're getting 6 hours, but if you can get 7, that is the ideal time. And guess what? Getting more than 9 actually has a negative effect on you. So sleeping late on the weekends, as some people like to do, they like to sleep till noon. That's not good for you. So after 9 hours, you should get up, get out, get moving. Get up, get out, get moving. So number 2, healthy eating. A Mediterranean diet rich in fruit, vegetables, legumes, fish, and nuts, minimizing your intake of processed foods, minimizing your intake of sugar, and minimizing your intake of red meat. This type of diet reduces cardiovascular disease risk, decreases inflammation in your body, and decreases your risk to disease states such as high blood pressure, high cholesterol, hypercholesterolemia, or diabetes, because they decrease inflammation, and all of those disease states are inflammatory in nature. So the mantra, when people say, what can I eat, Dr. Collier? What can I eat? The song I want you to have in the back of your mind is fruits and vegetables, fish and nuts. Fruits and vegetables, fish and nuts. Fruits and vegetables, fish and nuts. That will give you a long and healthy life. So cognitive engagement, because everybody now is very sensitive to the term dementia, and particularly Alzheimer's disease. So mental activities can help maintain general cognitive function and brain health. Strategy games such as checkers, chess, puzzles like Sudoku are very good mental challenges. They are exercises for your brain. And in reference to brain function, if you do not use it, you will lose it. You cannot zone out looking at television and game shows and soap operas all day and then Netflix and chilling all night and never really exercising your brain. So you want to make sure that you're doing activities that require multiple levels of thinking. And again, strategic card games like bid whist, spades, also very good. Checkers, chess once again, and word puzzles like Sudoku or even crossword puzzles, very good indeed. Guess what? Number 4, social activity. So interacting with friends, having nights out with your friends, staying in your tribe, spending quality time with people that you know and like you, has positive effects. One, engaging in social relationships actually helps improve memory scores because you're discussing, you're talking about sports, you're speaking about the news of the day, the activity, the election, things like that. And when you do that, that stimulates your brain on multiple levels and gives your brain exercise. So it helps improve serotonin, the feel good hormone, and that decreases your stress level, lowers your blood pressure, makes you feel good. And if you're going to live a long time, you want to feel good. Lastly, number 5, cardiovascular health. If you have a diagnosis of high blood pressure, monitor your blood pressure, take your blood pressure medicine, and control your blood pressure. If you have high cholesterol, monitor your cholesterol, take your cholesterol medication, follow a low cholesterol diet, and monitor your cholesterol when you go to the doctor's office. Find out. Don't just have lab work ordered on you. Find out what the results are and act upon the results. Don't excuse them away. The biggest thing that I see in my office, people come in, their blood pressure's up. And they always say, oh, but the last time I checked it, it was 120. It's always 120 over 80. Or when I went to the dentist's office, or when I went to the other doctor's office. And they'll give me a long list of all the times that it was good, totally and completely ignoring the times when it's bad. And the times when the blood pressure is elevated or bad is when you're at risk for an event, that event being a heart attack or a stroke. So very important that you monitor, control those disease states. And more importantly, if you are diabetic, please monitor your blood sugar. These continuous glucose monitors, CGM systems, they have the Dexcom system and the Libre system that basically allow you to wave your cell phone at your arm or at the sensor, and it will give you a real-time number so you can determine if something you're drinking makes your sugar go up, something that you're eating. If you're concerned, you say, okay, it's birthday time, I'm going to have a piece of cake. You can check your sugar before you eat it. If your sugar too high, you know to eat a little or not eat any. If your sugar is fine, you can eat an entire slice of cake. And you also begin to learn how your body responds to various types of foods, and things that may surprise you may not bother your sugar at all, and things that you thought may have been healthy for you may make your sugar shoot up. So it's one of the great benefits of those continuous glucose monitors is that once you learn that, your behavior changes and your blood sugar is just better controlled naturally. Your hemoglobin A1C comes down. You live a better life with fewer sequelae of diabetes. For men, problems like erectile dysfunction. For men and women, visual changes, ultimately blindness, heart attacks, strokes, amputation of limbs, starting off with toes, then the front half of the foot, the back half of the foot, what we call a below the knee amputation, above the amputation. Uncontrolled diabetes, number 1 cause of amputations in the world, not just the United States. And guess what? There's an amputation performed every 3 minutes somewhere due to diabetic disease states and problems with your circulation. So there was a study done on the multitude of supplements that are available and that you can take to help prolong your life. Again, longevity, living a long life. And guess what? Number 1, number 2, and number 3 were. Number 1, vitamin D. We have vitamin D on our website, Doctors D, at 5,000 international units per day. The best vitamin D product that is available. You take it on a daily basis. You will have 1, strong bones, 2, strong teeth, 3, healthy skin, 4, healthy hair, 5, it boosts your immune system function so that you are less susceptible to or unsusceptible to viral infections such as the coronavirus, the flu, the common cold, bacterial infections such as strep throat or pneumonia, or fungal infections such as fingernail fungus, toenail fungus, fungus under your breast, ladies, under your belly button fold, fungus between your legs called jock itch, all those, and vaginal yeast for women. All these things you're less susceptible to. But the magic happens when you get that vitamin D level up above 60, normal range being 30 to 90. You get that vitamin D above 60, and guess what? It's cancer preventive. Multiple studies have shown prevention of cancers: colon cancer, breast cancer, pancreatic cancer, prostate cancer, multiple types of cancers, probably all cancers, but definitely those have been studied and show that the first thing they do if you get a cancer diagnosis is put you on vitamin D. But guess what? If you take the vitamin D preemptively and proactively, you won't get cancer. That's the great thing about it. And then omega-3 fish oil, great anti-inflammatory, decreases inflammation throughout your body, so it decreases your risk for heart attacks and strokes, joint pain, inflammation, arthritis. Vitamin D is God's gift for inflammation and also helps with GI health, but it literally lubricates your joints. So when you're stiff in the morning, you won't be stiff. When you start to get early signs of osteoarthritis or degenerative bony changes, the vitamin D is literally like squirting oil in the Tin Man. You go from to smooth and silent, smooth and silent. So vitamin D, omega-3 fish oil, and probiotics, God's gift to GI health. No more constipation, no more diarrhea, no more problems with foul gas, no more burping. All these things improve your general overall GI health, but by changing the gut biome, every type of allergy problem, from dermatitis such as eczema to asthma to allergy eyes, sinusitis, scratchy throat, all of these things are improved and are totally relieved by changing the microbiome, muting the body's allergic response by using and taking the probiotic on a daily basis. Dr. Collier's Essential Trio, available right now on the Lipo Drops website. Go to lipodrops.com, and then you can see the products that are available. Go to the YouTube channel, AskDrMJ, and you can find videos that tell you exactly when to take each product, how to take each product to optimize your benefit from them, and everything from how to shave, men and women, to prevent razor bumps on your face and your skin and your underarms and in your groin, and just a variety of different healthcare topics. So go to the YouTube channel, AskDrMJ, and lipodrops.com, where you can find information on all of our supplements that will optimize your health and allow you to be the best you that you can be. Okay, Holly, let's go to the roll call now. Let's see who we have on this evening. Okay, there we go. Winnie King. Hi, Winnie. Thank you so much. Thank you for sending blessings my way. I greatly appreciate you, Winnie. You are a regular. We appreciate you. You're on the YouTube channel. Thank you so much for tuning in. Okay. Makiba Boland. Good evening, Miss Makiba Boland. So good to see you. Please stop by. I might have something, or call me first, and then we'll see if I got something special for you. Glenda Everett from Warner Robins. Hi, Miss Glenda. Thank you so much. We love the Warner Robins connection. We love to have you there. Ricky Woodard, good evening, sir. Ricky, I love when the men log in. Share this information next time you're having conversation at the barbershop, or your men's are gathering to talk about football or basketball. Talk medical as well. Lady D. Oh, I've aged backwards. Yes, I have. Again, that 30-pound weight loss from the Lipo products has helped Dr. Collier's youthful appearance, if you will. And then I was even brave enough to grow my mustache back. So I'm using the facial hair right now and trying that out again. I've had a mustache since I was in the 7th grade, and I shaved it for the first time about 6 to 8 months ago. And I had been no hair on my face. And now I grew back the mustache a couple of weeks ago. Glad to see it. Charlotte Lewis Lacefield, top of the evening to you as well. Thank you so much for tuning in. We're so glad. Hi, Miss Mimi Witcher. Hope things are going well in Tampa. Or if you're back in Atlanta, glad to have you back home. Patrick, good evening, family. One love. Patrick, thank you for tuning in via the YouTube channel. Kivia Green, good evening. Thank you so much for tuning in. Love your picture on your Facebook profile. David Holiday from Columbia, South Carolina. Ms. Holiday, thank you for joining us once again. We are so glad to have you participating in the Ask Dr. MJ. Why? Because your health is an important segment. Jennifer Monroe McKee, good evening from Jackson, Mississippi. Thank you so much, Jackson. You are in the house. Kim Ziegler, hello from Alabama. What part, Kim? We love Alabama. and all parts of Alabama, particularly as you move down toward the Gulf Coast. Miss Audrey Ngalu, greetings from Douglasville, Georgia. Thank you so much for tuning in. We appreciate you. Kim R. Rains from Raleigh, North Carolina. Hi, Kim. Thank you for tuning in as well. We greatly appreciate you. Paula Nance from Chattanooga in the house. One of my favorite cities to visit. Again, cannot beat the downtown area. Development is so user-friendly, family-friendly, and all the boutique hotels that they have there, really great. Fred White, thank you for your energy. Fred White from Orlando. Thank you, Fred, for tuning in. You give me the energy. I appreciate you. Kim Ziegler from Birmingham. Okay, not just Alabama. We are getting Bright Light City. Great things happened in Birmingham over the weekend. Had all these homecomings there and the Magic City Classic. That was great. Birmingham is an amazing city. Okay, let's get to it, Heidi. This is your show. And the thing is, Ask Dr. MJ. So ask Dr. MJ, what are your questions for today? Let's get to it. S. Blake, hi, Dr. Collier. My alkaline phosphatase is 321. Normal range is around 130. My doctor said that it's due to hyperparathyroidism and referred me to endocrinologist. What causes this and how should it be treated? Okay, great question. Alkaline phosphatase, again, your liver enzymes should be, that actually is up to 140 and 150 in some labs. But you don't get excited until it's 3 times normal, and you are right at the range of almost 3 times normal. So there are other things that can cause this too. Alkaline phosphatase is a liver enzyme. It is an indication that something is insulting the liver function. The hepatocytes, the hepatic cells are being insulted. Some toxin is damaging them in some way, and that can be something as benign as your cholesterol medication. Sometimes statin class drugs can do that to your liver. Other medications, sometimes supplements can do it, particularly those that are not manufactured well with good quality controls. Hyperparathyroidism is on the list, but not at the top of my list. Wouldn't be my first choice, but there are other tests that will confirm that. You can check the parathyroid hormone and a full thyroid panel, and you can treat that with medications that will lower that, and that will immediately bring the alkaline phosphatase down. The great thing is that even though an insult and damage to the liver has occurred and is occurring, the liver and the kidneys are 2 of the organs in the body that can literally regenerate themselves. So they can heal themselves, replace dead tissue, bad tissue with new improved versions. And so that is the key thing. That's why you literally could take out 2/3 of your liver and it will grow back to a full-size liver in a short period of time. That is why some people are able to donate liver for liver transplants for patients that have cirrhosis of the liver or hepatitis that has done liver damage, or even a liver cancer. You can take out that with a matching patient and do that. So the diagnosis has been made. It can be treated. So we expect great things from you. You shouldn't really be having any type of symptoms from this, other than when they took the blood work, they showed that your alkaline phosphatase was high. There are 2 other liver enzymes, the AST and the ALT. And if they are not also elevated, that's a good indication that liver damage is minimal. If they are all elevated, and I presume he would have shared that with you if all 3 of them were abnormal, that indicates a higher degree of damage to the liver. But either way, again, that number, I wouldn't get excited until that number was in over 500 or 1,000, in the thousands, and it can go that high. And so it's elevated. It is truly elevated. It is almost 3 times normal. So it's time to do something. But I definitely would, again, there's no urgency for the endocrinologist to evaluate that. The doctor, I'm surprised, he could have done it himself, put you on medication for it. But this is urgent, but not emergent. This is urgent, but not emergent. So follow up and let us know how you do. That should come down after you start treatment within 6 weeks easy. So before the end of the year, we want to hear from you, S. Blake, and we want to hear that alkaline phosphatase number is back down. Great question. Okay. Novi, hello. I have very sensitive skin. At night, I seem to itch more. I don't know if it's the sheets or what. What can I use for my dry skin? One, any lotion with vitamin E is very good. Or you can even get vitamin E oil. I get Suave brand, SUAVE, with vitamin E, not D. That's E as in epsilon, and use it liberally. What's more important, though, with your skin is what dries it out. One, you need to make sure that you're drinking enough water, so hydrate yourself. That would be 8 to 10 8-ounce glasses of water daily, not counting anything else you drink. Nothing cancels out water. And also, when you drink something other than water, a cup of coffee, a glass of tea, a soda, an energy drink, anything else, you also get a glass of water. You drink the cup of coffee, you drink the glass of water. If you get a refill on the cup of coffee, you get a refill on the glass of water. That can be anything. That can be Jack Daniels. That can be Crown Royal. If you're drinking a cocktail, you also get a glass of water. If you finish the cocktail, a glass of wine, and you refill it, you get another glass of water. So that will keep you hydrated. 2, use a mild soap on your skin, such as Dove for sensitive skin, and any soap, because of the process referred to as saponification, it can irritate and dry your skin out. So you want to make sure that you wash with a soap like Dove for sensitive skin, and then that you perform a rinse cycle. I even recommend using a separate washcloth that has no soap on it to remove the soap residue, because even a mild soap like that can still, if it dries on your skin, can cause itching. Thirdly, a non-sedating antihistamine. There are 3 on the market. There's Zyrtec. There are 4 on the market: Zyrtec, Zysol, Allegra, and Claritin. The Allegra, they all work, but the Allegra seems to work better with skin issues. So that's what I give to patients. The average dose is 180 milligrams, but you can take, that's 1 tablet. You can actually take 2 at one time, or 1 in the morning, 1 in the evening. Since you're itching at night more, I would take it in the evening after you get out of the shower, and make sure that when you take a shower, people with itchy skin, for whatever reason, love to take the scalding hot showers because they feel good while you're in there. But 15 minutes after you get out, when that skin has cooled down and the cool air hits it, it triggers a histamine reaction and will make you itch from head to toe for the next 3 to 4 hours, no matter what you do. So it's not necessarily sheets, although it could be. So make sure you're using a cotton sheet with a high enough weave, at least 600 thread count, so a quality sheet. And change your sheets regularly. Don't leave sheets on the bed for 2 weeks. Change the sheets regularly. Use the non-sedating antihistamine. The one I recommend first is the Allegra, then the Zyrtec. The Zysol, then the Zyrtec, then the Claritin. That will be my pecking order, but everybody has one that they think works for them. After you get out of the shower, taking a cooler shower. It doesn't have to be cold, just not scalding hot. So a cool to warm shower. Allow your skin, pat it dry with a towel upon exiting the shower, and then apply liberal amounts of lotion at night before you get into bed, so your skin isn't dry to start off with. That is a regimen that you will follow that will give you great relief, but you're going to have to maintain it. You can't just do it until you stop itching, because as soon as you stop doing it, it'll start back again. So this is a lifestyle change that you need to implement and keep implemented so that you won't have problems with dry skin. Great question. Okay, Will Jason, is Keppra the best med for seizures as a non-medicine remedy? Thanks. Will, that's a great question. I don't know of a non-medical remedy. There are actually, depending upon the type of seizure, some actual surgical interventions where they can go in and separate the 2 halves of the brain, so that because seizures sometimes will start on one side of the brain, go to the other side of the brain, and then go down the body, and they can cut that, called a corpus callosum, and prevent that from happening, and that stops seizures in somebody. There are other electrical stimulations and or electrodes they can put in various parts of the brain that will fix it. That's still medical, but it's not pharmacological. Pharmacologically, there are multiple types of seizure medication. Keppra is one of the best ones, but not the only option. And what's important is what works for you to control your seizures. So it has to be the right medicine, and then it has to be at a therapeutic dose. A lot of individuals will take a medicine, and because it, particularly when you first start taking it, it may be a little sedating and make you feel a little sleepy. But if you keep taking it, that will go away. And then you have to be at a dose that's high enough to maintain and sustain seizure prevention. The problem is, if you have seizures uncontrollably, you can fall and hurt yourself. You can, injure yourself if you have an uncontrolled fall, or God forbid, if you're driving You have an accident, which can hurt you and somebody else on the road too. So you have to be very careful about that. And if you have had seizures that have been that debilitating, you have to be on medication and seizure free for at least 6 months before you're cleared to resume driving. So it's a lifestyle. And the problem is we don't know why people have seizures. Some people have them spontaneously. Some people have them as a result of a head injury where some insult has happened to the brain. It has healed, but after healing, the electrical activity, which the brain is nothing but a big power center and a big electrical, where electrical sparks are constantly flying, but they actually have a pattern that's significant and needs to be sustained. If that pattern is disrupted, it short circuits everything, and that short circuiting can result in seizures. Now, there are various types of seizures. There's what are called absent seizures, where I could just be talking to you and then all of a sudden, and then I come back. And so you don't even know I had a seizure. I don't even know that I've had a seizure, but that's an absent seizure. And then the traditional seizure, where you have what's called tonic, clonic, shaking and jerking of the extremities, the hands and the feet. And sometimes your eyes are blinking or roll back into your head. The biggest problem is, for whatever reason, a common thing is for your jaws to lock tight. And if your tongue happens to be sticking out, you can bite your tongue, which is why they recommend that you put something in a person's mouth. They used to say a spoon, but people would bite spoons and break their teeth. So something soft, if possible, and don't jam it down their throat. The objective is just to keep the teeth from clenching. So you don't have to try to jam it in the front. You can stick it on the side, something soft that would just not allow the teeth to clench together, which would actually bite or cut the tongue if it's in there. Then once a person has completed the seizure, there's usually a period of fatigue, sleepiness called the post-ictal period, particularly if it was tonic, clonic, where they were shaking and jerking, because that really requires a lot of energy. And then after that, they're fine until the next time they have a seizure. So the objective is to prevent that from happening. And sometimes with seizure, other activities can be loss of control of your bowel and or your bladder. So the question I always ask people: did you bite your tongue? Did you lose control? Did you wet your pants? And did you lose control of your bowels? And that's a totally different level of seizure activity, because that really is going to your parasympathetic system as well as your sympathetic nervous system. So parasympathetic is salivation, lacrimation, urination, and defecation. The sludge, salivation, lacrimation, urination, defecation, as well as ejaculation and orgasm for women. All those are parasympathetic nervous system functions. And if that's involved, that's like inside. And then sympathetic system is more like outside. And so your large muscles and things like that. So that's where we are with that. Great question, Will. Jesse Rutledge, what's the best medicine for better blood circulation in my legs and the rest of my body? Guess what, Jesse? Exercise is the best medicine, because it improves your heart function. So your heart is pumping a little better, and it's getting blood to the most distal part of your body, which is your feet. The further away from you are from the heart, the more difficult it is to get blood there, because it has to travel a longer pathway. So doing things like that, if you have high cholesterol, taking a cholesterol lowering medication, supplements that we recommend, again, the omega-3 fish oil is very good for improving circulation. It decreases the inflammation inside the blood vessels, which shrinks the walls of the blood vessels down. And so instead of having a tight pipe like this, you got a wide pipe like this. So you got same amount of blood flow, less pressure, and better circulation, because you have bigger pipes, for lack of a better way of putting it. There are other medications, that pharmacological interventions that you can utilize as well. Anti-inflammatories, natural anti-inflammatories such as curcumin, turmeric, are also very good to help with circulation. That's why they give you a blush, because you're improving circulation peripherally, which makes you appear red and or blush. So those are things as well that we would highly recommend. So, but again, aerobic exercise, something to get your heart rate up and going, keeping yourself moving. Support over the calf men's support socks, not compression socks. There's a big difference. We're not talking about the compression socks that are that off-white beige that look ugly and only come in one color. Sometimes have a little hole in the toe that allows for the bottom of your foot to be exposed. Very unpleasant and uncomfortable to get on, but very difficult to get off. You can accomplish the same objective with over the calf men's support socks, and this is for ladies as well. There's no difference in men's and women's socks other than they may be a little bigger than women's socks, but they don't make support socks for women. They make support socks for men. And so you can go on Amazon and order support socks over the calf. Very important that they are over the calf, and that will give you great benefit. Dr. Collier wears over the calf support socks every day so that I don't get swelling in my legs and feet, because that compression closes the space where fluid would accumulate. It also prevents you from getting varicose veins and other kind of peripheral circulation problems by helping support the return of blood from your arteries. The arteries take the blood away from the heart. The veins bring the blood back to the heart. The arteries have active pumping mechanisms and muscles in the walls. The veins are passive. So if the vein starts to stretch and dilate, that's when you get the superficial vein problems where you don't have laminar flow. The blood should flow in a very smooth line. When you get varicose veins, the blood starts to churn, and when blood churns, it breaks up blood cells, or it clots. One or the other. Both are big problems. So those are things that you can do, Jesse. Do those things and let me know how you do as far as your circulation is concerned. But go to the website, lipodrops.com, get that omega-3 fish oil, 2 capsules a day, 1 in the morning, 1 in the evening. Doesn't have to be taken with food, but it's better absorbed with food. So I just take mine right before I eat or mid-meal. However, if part of my morning routine is taking my omega-3, then I'll take it without eating anything, because I'm at the sink brushing my teeth. And so I don't have to have food. It's just absorbed better when you do take food, or when you do take it with food. Okay, great question. What part of the day are you supposed to take the Lipo T? Hey, TJ, how are you? The Lipo T is the male supplement that improves erectile dysfunction, increases your testosterone levels. All these commercials that you see when you're watching football games with all the old former athletes talking about how their life has been improved by products like that. My product is like that, but much better, higher concentrations of those things that we're talking about, and multiple things in one product versus just one type of supplement. The Lipo T product has, I think, 7 or 8 ingredients, and those 8 ingredients all enhance your erectile function, increase your body's natural production of testosterone, improve and enhance the intensity of your orgasm, so that if you're a quiet lover, now you'll be a screamer, because it feels, if your orgasm was on a 5 or 6 level of intensity, now they're 10 plus. So it feels the way that it used to feel when you were 13 or 14 years old and you had just discovered what it felt like. It feels that way and can feel that way again. So the Lipo T should be taken in the evening, anytime after dinner or right before bedtime. So you got that window. If you're eating dinner 7 or 8 o'clock, before you go to bed at 11 or midnight, anytime in that window is fine. It's just better absorbed and works better overnight while your body is resting. It turns on all the testosterone manufacturing that now can be focused on that, because the rest of your body is sleeping. So it's not engaging or using energy or effort for anything else. You're sleeping and your testosterone factory is turned on, and boy, it makes a difference. When you wake up, you're going to be a totally different person. And after you've been taking it for about 2 weeks, you're really going to notice a change. Dr. Collier takes the Lipo T every day. And let's just say that Mrs. Collier is glad that he does. So this is great, a great product, and we really, really highly recommend it and endorse it. Now, what I don't like is for one person in the family to be hypersexualized. And so we've had the Lipo T product for a decade. And I'd be doing public speaks, and sometimes even on this channel. And the ladies will say, you got something for the men? Well, what about us? We need something too. So that's when we came up with and created the Lipo Hers Ladies Supplement. Now, talking about a life changer, the Lipo Hers is probably one of my most popular products now. And I'm just so sorry, ladies. I apologize in advance for taking so long, not understanding, not hearing you until I heard you, and then saying, okay, we need something for the ladies. And we got the Lipo Hers, baby, and it is amazing. So now you got 2 individuals in the house, the man taking the Lipo T, the woman taking the Lipo Hers. So you got concordance, you are equally yoked, and things are really going to be popping in that household. So you will really enjoy, ladies, the way that it is the youthful period. It's like the fountain of youth, but it also, the supplement makes your vagina thick, makes your vagina moist, makes your vagina tight, and drives your libido through the roof. So not only is your vagina wet, moist, thick, and ready to receive, mentally and physically, you want to do it. So I don't know if you can remember the last time you wanted with enthusiasm to have sex and seek orgasm, but you will be with enthusiasm wanting sex and seeking orgasm and having mind-blowing, screaming off the, pulling the sheets and kicking, having orgasm like you used to. And if you've never had that type of orgasm, you can have that kind of orgasm with the Lipo Herbs. So go to the website, lipodrops.com. Look at the Lipo Herbs product and see what you got. But TJ, the Lipo T, it has capsules. You can take 2 or 3. Each bottle has 90 capsules. If you take 3, that's a 1-month supply. If you only take 2, that's a 6-week supply. And so start out depending upon where you feel as far as your libido is concerned. If you feel like you need 3, just start taking 3. And then once you are Superman, you can cut down to 2 as a maintenance. Again, Dr. Collier takes it every day. I take 2, and that's a maintenance phase right there. I took 3 maybe for the first couple of weeks to build up, so to speak. But then once build up and sustained, now it's just a maintenance program. So the maintenance program is 2 a day, anytime after dinner and before you go to bed. Great question, TJ. Paula Taylor, good evening. Your vitamin package, how do you recommend you take them, and do I need to get approval from my doctor before taking them? You don't need approval from anyone because each product that's on the Lipo Drops website is perfectly compatible with any disease state and any other prescription medication that you're taking. So you don't have to worry about it. There are no stimulants in our weight loss products, so they will not affect your blood pressure. They will not affect your blood pressure medication. They are perfectly okay to take under those circumstances. So the vitamin package is the Dr. Collier's trio. That's the omega-3 fish oil, the vitamin D, and the probiotics. The other products, the weight loss products in particular, the Lipo Drops, are taken. You squirt the drops under your tongue. The dropper that comes in the bottle squeezes up the perfect amount, 1 milliliter, every time you squeeze it. So it's fail-safe. So you gently shake the bottle to mix the solution. You don't shake it vigorously. You just gently rock it back and forth a few times. Squeeze the dropper, get a dropper full, squirt it under your tongue, hold it under your tongue for 2 minutes. That is where the Lipo Drops maximum strength weight loss product works. It does not work in your stomach. So people were squirting it on their tongue and swallowing it immediately, and it does nothing for you when you do that. It has to be absorbed in that mucosa under the tongue. That is as effective and efficient as taking an injection. You hold it under your tongue, it's probably absorbed in about 1 minute, but I say 2 minutes just to optimize and make sure. Then you swallow it. But once again, it does absolutely nothing in your stomach. What does it do for your stomach? It shrinks that belly fat. Lose the muffin top with Lipo Drops. So if you can pinch an inch or more here and you want to lose that, this product specifically targets that area. So you will lose weight from that area. You will also lose weight from areas you cannot traditionally exercise from, like under your chin, across your back in the bra line, ladies, under here, those wings, those bat wings under your arms here, the outer thighs, the inner thighs, all those areas where you have fat pockets that do not respond to exercise, you will lose with the Lipo Drops maximum strength formulation because they change the way that your body metabolizes fat so that you use the fat as fuel and it is not stored in those areas in your body. So when you first start using it, your body stops storing the fat, your energy level goes up, and you see that your metabolism is there and you're not as hungry. But then after about second week, all of a sudden your body recognizes this phenomenon and it says, hey, not only do I not need to store food as fat, I can release the fat that I have stored because I don't need it anymore. And all of a sudden you literally just start to melt. It is an amazing process, and you get definition without doing a single sit-up, push-up, crunch, because the fat is leaving the muscles and the muscles themselves have reasonable definition. Then you can do aerobic exercise and or a lightweight lifting to get some true muscle definition when doing so. So that's where we are with that. Okay, next question. See if we can get, there we go. Who is that guy right there? It's Dr. MJ Carr. You want to make sure you can see that. Okay. I think let's do it. Michael B. I've been recently diagnosed with MM, experiencing more foot cramps than I had before. Bone lesions, medication, how do I tell? MM, I'm presuming you mean multiple myeloma. which is a condition that affects the muscles, but predominantly the bones. You get what are called lytic lesions. That's the bone is literally, instead of being long and smooth and like a pool ball, smooth surface, the bone starts to get chips in it like the moon surface. So those lytic lesions are weak areas in the bone that are subjected to fracture, but they also increase the calcium levels in your blood, because as the bone breaks down, it releases calcium. So one of the ways, the first way that that's diagnosed, your calcium levels will go up on a routine blood test. And then the question is, why is your calcium level so high? And so then they can do imaging studies, x-rays in particular, to see the lytic lesions on the bone. But you don't get a true diagnosis without a blood test biopsy to determine that is indeed the case. Fortunately, there's lots of treatments now that the body responds to that are curative, and a lot of people respond quite well to those treatment options. So the foot cramps are probably because of the high calcium levels. Calcium causes spasms in the foot, so you need to stretch your feet and your legs out so that you don't start getting cramps in the long bone or long muscles of the body, but particularly that foot will cramp up. So as your calcium level come down, and there are medications that can leach the calcium out and make you urinate it out, so that those levels come down. Because when the calcium gets too high, it affects all muscles, including the heart, which is a muscle. So the cardiac muscle fibers can be affected in a negative way, and they can spasm, lock up, just like you get a cramp every place else. The problem is you don't want a cramp in your heart, because if your heart seizes, blood isn't moving. When blood stops moving, it clots. A blood clot in the heart is a life-threatening experience. So you want to make sure that you're staying hydrated, that you're moving that calcium out of there, and you're taking the things that get the calcium level down. So that's it, Michael B. Good luck with that. Let us know what your treatment regimen includes, and we can give you more advice on that. But sounds like your doctor's on top of it. Hi, Lynn from St. Louis. What are the best supplements for memory? So glad that you asked, because we got two now. Our Lipo shrooms. Lipo shrooms are very good for the memory. And if you go to the Lipo Drops website right now, for a thing, not just short-term memory, but helping with early stages of dementia. It can delay onset or totally prevent. You've heard of products that are on the market now. I see commercials all the time about people talking about these sorts of things. And so we want to make sure that you're taking something that is high quality. Our Lipo shrooms are an excellent product to help with memory. And then products like black seed oil. Black seed oil is also very good for supplements as far as memory is concerned. You may have seen the commercials talking about a product called Prevagen. I have no personal experience with it, but I have patients that think it is the greatest thing since sliced bread. I have other patients that have taken it and don't feel like they've gotten any benefit from it. So it's just kind of like a lot of things, a lot of supplements in particular. There are people that love and swear by them, and there are other people that say they didn't get any real benefit from it. So, but the things that I'd highly recommend are Lipo shrooms. Our Lipo shrooms are absolutely incredible for that. And I think, again, the omega-3 fish oil, which decreases inflammation, the process of Alzheimer's disease, of various types of dementias, are all inflammatory conditions in the brain proper. So to get improvement, to decrease the inflammation, vitamin D, omega-3 fish oil, vitamin D, omega-3 fish oil, vitamin D at a therapeutic dose. Our dose is 5,000 international units per day, the most effective dose that you can take. And we have a very high quality product that is very easy to absorb. And then the omega-3 fish oil. Most omega-3 fish oil capsules are 1,000 milligrams. Ours are 1,480 milligrams. So you only have to take 2 of them. Other products, you have to take 3 or 4 to get a therapeutic level. People that get 100 milligrams of omega-3 fish oil and they're only taking 1 or 2 of them are totally wasting their mind, their money. They're not getting any benefit because they're not taking a therapeutic dose. Also, when taking that supplement in particular, omega-3 fish oil is literally just that. It's all made from fish. If you get a product that are capsules, and it's a capsule 99% of the time, if you pick that one, if you open the bottle and it smells fishy, it's a poor quality product. It's a poor quality product. If you pick the capsule up and it is not crystal clear that you can see through it and possibly type through it, read a magazine or a newspaper or see your computer, If it's cloudy, it's a poor quality product. That is the biggest problem that we have with a lot of, because they literally can just take fish, put it in a blender, take that liquid out and put it in a capsule. And it's got all various types of impurities in it. It smells fishy. And if you take it and it causes you to get the queasies, in other words, it doesn't sit well on your stomach and you're burping it up and that bad foul taste is coming up, you're not going to want to keep taking it. So our omega-3 fish oil, fragrant, clear, no fishy smell when you open the bottle. And when you take it, you won't notice any problem. There will be no burping of fish taste or anything like that. It is an amazing high quality product and it gives you all the benefits. And only having to take, I take 1 capsule in the morning, 1 capsule in the evening with a meal, but you can also take 2 at one time if you like. The objective is to get 2 in a day. I just spread it out because I'm taking the other supplements as well, and it gives you a chance. If you go to the YouTube channel, I have a whole video about my morning regimen that shows you exactly how I take it. So I spread it out by a few minutes while I'm doing my morning routine. Take a pill, take a capsule, brush my teeth, gargle, take a pill, capsule, take a capsule, shave, take a pill, take a capsule, take my shower, get out of the shower, dry off, take a pill, take a capsule. Because if you take the product or any medication, you take it with a full glass of water, it will be out of your stomach and into your system in as little as 2 minutes. The biggest problem that we have when taking medications, and particularly supplements, we'll get a full glass of water, we'll wet our mouth, take the pill, take another sip, possibly take 1 more sip, and then throw the rest of the water back in the sink. Now what you have is a wet product sitting in your stomach, turning into gum that will sit there for hours. You will be burping up a bad taste. It won't sit well in your stomach because your stomach will try to digest it. The more your stomach tries to digest it, it's kicking out acid. That acid starts to give you gastritis, irritation. It can give you nausea, all those things. And more importantly, it can give you, even predispose you to stomach ulcers. But if you complete that full glass of water, 8 ounces, swallow it. You don't have to gulp it down. Take your time and drink it, but drink it within a few minutes of drinking, of swallowing the pill. It will melt that tablet. It will be out of your stomach and into your system. If you want to test this theory, take something very innocuous and inexpensive like an aspirin. You get a glass of water, you fill it up about this high. Let me see if I can get that in the frame. That's about a quarter of a glass. You put an aspirin in there. You don't stir it up, don't shake it up, just put the aspirin in there and sit it down. You take another glass, fill it up to the top. You drop an aspirin in there. You sit them side by side on the countertop and just walk away from it. 2 minutes, you come back. The tall glass with the full glass of water, the pill will have disappeared without agitation, without stirring, without doing anything. It's just the physics of the liquid. The smaller glass, you'll probably see the pill sitting in the corner somewhere, again, turning into gum. That takes hours and hours and hours to digest, but more importantly, to get it out of your stomach and into your system. That's where you want it. It does you no good sitting in your stomach. You want to do that. So take always your rule of thumb, full glass of water for no more than 2 to 3 pills. And then if you got to take more than that, take another full glass of water. The good thing about that is that gives me 3 to 4 good full glasses of water in the morning. I'm already halfway through my daily requirement. The only caveat, I have to make sure I empty my bladder before I get in the car driving to my office. Because if I don't, 4 glasses of water can be a problem on the highway if there's traffic backs up, if you know what I mean. So make sure that if you follow that regimen, or you've had 2 to 4 glasses of water that morning, that you empty your bladder before you get in traffic and start driving. Or know your route to work well and know where the best QT stations are with the cleanest bathrooms. There we go. Okay, great question. Orlando Negron Rodriguez. What is the best natural medication for alleviating severe arthritis pain in the lumbar and sacral regions? Combination of things, Orlando, are one, range of motion exercises to get those joints moving, because when they hurt, we have a tendency not to move, and when you don't move, the joints will lock up. But not only that, they'll start to grow calcium spikes, spicules, and spurs, decreasing that range of motion and possibly fusing those lumbar vertebrae, which will permanently decrease the range of motion. Omega-3 fish oil literally oils the joints improves your range of motion. And so, and it just lubricates and also decreases the inflammation. So again, omega-3 fish oil, the vitamin D, which is also the body's natural anti-inflammatory. Any other anti-inflammatory you can take. You want to make sure you're putting spices in your food, hot sauces in your food. Again, curcumin and turmeric are spices that are anti-inflammatory in nature. Turmeric comes in capsules, comes in tablets, comes in powders you can make into teas, or that you can sprinkle on your food. All kinds of ways that you can do that. But if you already have severe enough arthritis in your back that you're having moderate to severe pain, or pain is radiating down to your hips and down your leg, you need to start taking that regimen now. You also would benefit from chiropractic adjustments. You and your chiropractor should be best friends. You should not only see them regularly to start off with, possibly 3 times per week for maybe a month, and then a maintenance program, which would be anywhere from 1 time per month to 1 time per week, depending upon what your needs are. And then once they have taught you various types of exercises and stretching regimens, don't just wait till you're at the doctor's office to do them. While you're at home, when you're watching football game, get up off the sofa or the couch, get up out of that movie theater chair in your man cave with the 95-inch flat screen, and move, stretch, move that back, move the rest of your body as well. And spend every time a commercial comes on, get up and move. I try to myself conscientiously do this when I am having a problem like that, because I noticed that as we become more senior, as we age, you can stiffen up. You sit there and watch a full football game before you move. You get up, you're making those old man sounds. Groaning and moaning as you move. So you want to make sure that you're moving. So my rule of thumb is when a commercial comes on, I get up and move. It may be take a few laps around the recliner. It may be go a lap around the room if I'm in the video room. All those things, but just something to move out. Go out to the mailbox, walk out to the mailbox to check the mail. Take a lap around the house, because the commercials are usually 3 to 5 minutes when you can do that. And you'll find that just naturally moving. Other things, Tai Chi, the greatest exercise of all time. And if you're really feeling adventurous, yoga. All are things that not only you should incorporate into your exercise regimen, that should become a part of your routine lifestyle. Because if you have that problem is not going to go away. You can mitigate the symptoms. You can modify the symptoms. You cannot fix this problem once it's there. You can only control it. And controlling it will require a mixture of anti-inflammatories and not just necessarily natural remedies. Ibuprofen, Motrin, naproxen, Aleve, Tylenol, extra strength, or arthritis pain. All of these are good options as well to take in, or as supplements. Natural medications are supplements that are taken in addition to, not instead of. If you are warranted and have received a prescription medication for this disease state, take your prescription medication as directed. There is no honor in hurting. If you are hurting, it is a lifestyle altering problem that will not change and will only get worse as time goes on. If you get relief from a pharmacological intervention, don't wait until you are in excruciating pain to finally take a pill. Take the pill to modify, to prevent. If the medication should be taken twice a day or 3 times per day, take it 2 or 3 times per day, and then you won't feel pain, or your pain will be moderate instead of severe. Things will change. You will say, wow, I don't feel as bad. Guess what? That's what the medication does. But if you wait until, well, I don't like to take medicine, Dr. Collier, until you're in such excruciating pain that you have to, it sets up a whole series of pros and cons. You get muscle spasms. Spasms cause pain. The pain causes muscle spasms. So it's cyclic in nature. You have to break that cycle. Once you have broken that cycle, it's much easier to maintain a state of near or good health than it is to re-break it if it resumes again. Every time you go through a cycle, it worsens. So it's best to modify, keep it under control. That's what I advocate, and that's what I tell all of my patients. And I have I tell patients, if you do half of what I ask you to do, you'll do good. If you do everything that I ask you to do, you'll do great. But if you say, well, I don't like taking medication, Dr. Collier, I don't want to take supplements, I'm going to, take some some vinegar. I'm going to take some garlic. I'm going to take something else, which are all perfectly good and natural. But these are in addition to and not instead of. But the bottom line is musculoskeletal discomfort, pain, and arthritis all are a function of lack of movement, decreased movement, and the least you do, the least you will be able to do. So you got to get moving and keep it moving. All right, great question. This is my first time, Figures TV, but I've heard you every Wednesday on the Rickey Smiley Morning Show. I'm a drinker, having trouble losing belly fat. What are your recommendations in our Vitamin Shop supplements as good as yours? They have great supplements at the Vitamin Shop. I wouldn't say they're as good as mine. We pride ourselves in the whole Lipo Drops line of having the highest quality supplements that have quality controls that are the best. If it says it's got 1,000 milligrams of a product in it, guess what? It's got 1,000 milligrams of that product. It does not have rice fillers, or sometimes you can buy supplements that have none of what it's supposed to have in there. It's just got a pretty capsule or a pretty bottle with a pretty label, but it doesn't have what it is you're trying to get. Or if it says it has 500 milligrams, it's actually got 30 milligrams or 300 milligrams. You don't know what you get. So quality in your supplements is very, very important. And you can have faith that each and every product that you purchase from the Lipo Drops line at the Lipo Drops website is the highest of quality. And oftentimes, for instance, our probiotic product, there are probiotic products out there that only have one type of bacteria. Probiotics are nothing but good bacteria. And the unit of measure is colony forming units, or CFUs. And for a quality product, it should be in the billions with a B, not the millions. So if you got a product that's got one bacteria in there and it's only got millions of that bacteria, it's a total waste of time. It's a waste of money, but that's also why it's inexpensive, because it has nothing in there that's going to help you. So you'll take that and say, oh, I took probiotics and they didn't help me. Well, that's why it didn't help you. It needs to meet that criteria. Our probiotic formulation has 7 different types of bacteria in it, each one in the billions of colony forming units, B, billions with a B, which means you have a mixture. All your eggs are not in one basket. There are products out there that do meet the criteria of billions of colony forming units, but they only have one bacteria. So you get that one bacteria, it becomes the predominant bacteria in your gut biome. So your microbiome in your gut now is predominated by one thing. That is never good, because that one thing can go bad on you at any point. But when you have multiple things occupying the same space at the same time, it provides a check and balance system that keeps everything and everyone in check. So you're also getting exposed to different sorts of things, so your body has a better ability to adapt under those circumstances versus just having one thing that's been exposed to. So that's why we have faith in the products that we have. Again, but I've had good experiences at the Vitamin Shop. They have counselors in there that will walk you through a variety of different things, and you tell them what your symptom signs are, and they will help you tremendously. And so, again, that is a local option, but our Lipo Drops website will ship to you at no cost. So if you would like to go shop, go to the Lipo Drops website, see what we got on there, see if it's something that you need, want, or desire. Okay, great question. James Lewis. As a type 2 diabetic, I take metformin. I understand we need to be at 125 milligrams and lower, but realistically, I'm at 192.10 in AM, but it drops to 155 by noon. Do you have products? One, the metformin that you're taking is a great product. You have to make sure that you're taking it at a therapeutic dose. The problem with metformin is most doctors in the United States will prescribe a dose from 1,000 to 4,000 milligrams. Sometimes 4,000 milligrams, 4 1,000 milligram tablets at one time, which is virtually assured that you will get GI upset. The European model for the use of metformin is only 500 milligram tablets, but you take one with each meal, breakfast, lunch, and dinner. This is very, very effective in lowering and controlling your blood sugar with minimal side effects, but metformin also has an amazing anti-aging function, and is being utilized now in anti-aging facilities around the world because it slows what's called apoptosis, or cell death. So your cells don't die as quickly as they would, and they don't age as fast. So you look better, you feel better. The anti-aging component is very good. And this is for people that don't have diabetes. But yes, you do need to be under 125. 190 to 210 is too high. It's kind of like being a little bit pregnant. 155 is good, but not great. A fasting blood sugar should be under 100. A non-fasting routinely, meaning anytime I check your blood sugar, it should be 160 or less, regardless of what your food status is. But if you're fasting, overnight fast, meaning not eating anything or drink anything after midnight, and we check your blood sugar, it should be between 100 and 120, ideally right around 100. So you need to work with your provider to do so. All of our products, particularly our probiotics, will help with the way that your body metabolizes and utilizes foods, particularly carbohydrates. So get the lipobiotics. Take one capsule in the morning with your breakfast, one capsule in the evening with your dinner, and you will find that the way that your body metabolizes foods, particularly carbohydrates, will change in a positive fashion. So this brings to an end this episode of the Ask Dr. MJ. Why? Because your health is important. Facebook Live, Instagram Live, now TikTok Live, and YouTube Live broadcast where you, the listener, can call in, write in, text in, and ask your healthcare questions. So we're going to have another show right after Thanksgiving. That's going to be our week. We're going to look forward to that. So tune in, tell all your friends, go to the YouTube channel and subscribe, because you can get a lot of information from the many, many videos that I have there, particularly about the use of lipo products, but virtually any health topic we have covered on there. So subscribe and follow, and we'll see you next time. Follow me on Facebook. I'll follow you back. I promise. Ask Dr. MJ. We'll see you next time.